Obamacare and the Affordable Care Act were supposed to make things better. It was supposed to make everybody healthier, but it doesn't seem to be working that way. And part of this is based off conversation you and I had before on the show. But walk us through that.
Yeah, after doing some research, I found that somewhere between 200,000 and 250,000 people or families every year go bankrupt due to a medical event, even though they have health insurance. So they have health insurance, they think it's for protection so you don't get into any financial distress. And what actually is happening is you are getting into financial distress because you have health insurance. And so people think me saying I'm uninsured is risky, where I say, no, you having health insurance actually is risky because you have somewhere between a 1 in 6 and a 1 in 3 chance, depending upon where you live, that your bill's not going to get paid for. And so that's a tragedy to me. Like I said, I've been fortunate. I can pay an $8,000 bill, but most people can't, and that's putting people into bankruptcy. So it's the big claims that are denied are putting people into bankruptcy. And then what other people don't understand is that you've got a deductible you have to hit before the insurance plan pays $1. So, I looked at the Obamacare plans for this year for me and my family just because I was curious, and it was $1,300 a month and $16,000 deductible, which basically means that I have to pay $30,000 before the health insurance plan pays $1, which doesn't make any sense to me. I mean, we're a healthy family, we all take care of ourselves, and so me paying $30,000 to an insurance plan only to hope that they pay when the big one comes just didn't make sense to me as an individual. And I'm one of the only ones out there that's like, I think more people should be uninsured as opposed to less. Yet the bureaucrats in DC, they say, look, Obamacare is working. All these people who are uninsured are now insured. And I was like, hold on a second. You're forcing them to pay a monthly premium only to deny their big bills later, putting them into financial distress. That math doesn't work for me.
Math ain't math. And it $1,300 a month, and I'm not a math whiz, 13 times 12, what is that? Is that 30?
It's about $17,000, something like that.
$17,000, and then $16,000 you said in deductible.
Yeah.
That, and so someone like yourself, you're in your 40s, I would think. Your wife probably in the same age range. You got that's a pretty healthy age range. Where are you going to have $30,000 a year in medical bills?
No.
Unlikely.
Very, very, very unlikely. And what I found is after doing some research, because I was uninsured, of course my wife looks at me and says, we're uninsured. What are you going to do about this?
Right.
And as I did some more research, what I found out is that me being uninsured, I actually have a lot more power to negotiate with these hospitals than United Healthcare does. So that $8,000 bill, I posted that on Twitter, and I had an ear, nose, and throat doctor reach out to me and said, oh yeah, we do those for $2,000 in our office every day. And so just by me, if I paid in cash, so just by paying in cash, I could have gotten a 75% reduction in that bill by relying upon myself to pay that as opposed to an insurance company paying it for that, right? And so it just works out that you have more negotiating power against these hospitals. If you think about these insurance companies, I live in Austin. There's 2 big hospital systems in Austin. So United Healthcare comes in and says, even if they wanted to, I'm reducing prices. If one of those hospital systems says no, United Healthcare is screwed in Austin. So in essence, what is happening is you have these duopolies, monopolies, negotiating with these other big companies, and what they do is they just drive the prices higher. And so when people ask me, Andy, explain it to me like I'm a 6-year-old, why healthcare prices are going up. And what I say is that you have the sellers of healthcare, which are big hospitals. They want the prices to go up. That's obvious. Of course, they're providing a service, and capitalism, they want the prices to go up. I get that. Totally fine with that. But you also have the big health insurance companies where very few people understand this. They actually want the price to go up too. So with Obamacare, what they did was they said that, hey, health insurance companies, you can only spend 15% of premiums on your people costs and your profit, which means that if my premium, just to make the math easy, was $1,000, they could only spend $150 on the people at the health insurance plan and the profit. So what that means is that to have their profit increase, which is what for-profit want, they actually have to have their premiums increase. So now you have the sellers of healthcare, the hospital systems, and the buyers of healthcare, the health insurance companies, both wanting the price to go up. So when you have the buyer and the seller of a product that wants the price to go up, guess what? The price goes up. You don't have to be an economist to understand how that works.
Let's be honest. The insurance model is broken. CrowdHealth puts your healthcare back in your hands. Use the promo code FEARLESS at joincrowdhealth.com. That's joincrowdhealth.com, promo code FEARLESS. Andy, I'm a journalism major. I'm a good writer. I told you before the show I went to Ball State. So we're going to have to dumb it down just a little bit more for me. I think that was good, but sometimes I just need to hear it over again so I fully understand it. The premiums that they can charge, that's what they charge you a month for the insurance.
Yep.
They can only take 15% of that money and spend it on what?
On the people at the health plan, so all the administrators and all those, and profit. So the insurance company can only take 15% for their corporate use. All the rest,
other 85%, what's that?
That's on care for their people, for their members. So you have to spend 85% on medical expenses and 15% on administrative and profit. So how do you allocate more for administrative and profit? You have to have the medical expenses actually go up over a period of time. So that means premiums have to go up. So they actually, over a long period of time, they want prices to increase. And so that's the challenge with our system, is you have both sides of the equation wanting the price to increase over time. So over a period of time, they want the prices increased, but let's think about this year, right? Let's just say I have 1,000 of premiums, and the amount we're spending on medical needs is approaching, not 85%, but it's going to 86% or 87%. Well, that's now taking away from my profit. So the insurance companies say, okay, well, I gotta knock down that 87% to 85, right, to maximize my profit, which means they start denying claims. And there was an article, even in those last 2 weeks, the company that the insurance company uses to approve or deny those claims, they actually have like a little gauge where it says, I'm going to make it harder to approve or less hard to approve, depending upon what the insurance plan tells me they need to do on their end. So the information, remember I told you that the doctors have to get approval to do this. They make it harder to approve those procedures or less hard to approve based upon how they're doing financially during the year to maximize that 15%. So in year, you're screwed because they're going to deny claims. Over any kind of length of period of time, you're screwed because they actually want premiums to increase. So we have a principal agent problem, is what they call it in economics. They're supposed to be our agent. They're supposed to do what's best for us. But in reality, what they are incentivized to do is to do the worst for us, both short term and long term. And so that's why people are really pissed off with health insurance.
Did you ever watch, there was a TV show, it's my favorite TV show, called The Wire.
I haven't seen it.
Yeah, it's about police in Baltimore and drug dealers in Baltimore. And they talked about how the police stations would juke the stats in order to have them be in favor of what the mayor is promising or city council's and that's, I'm listening to this, takes me back to The Wire. It's like, they're juking the numbers, they're playing with the numbers. And it's just all a game being played that we don't even know is going on as a consumer, but that is what's going on. And so do you think that when I hear RFK getting involved and Make America Healthy Again and the HHS?
Yep, HHS.
He's been put in charge of. Is this something he can impact or influence or even just use his platform to make us aware that what you're talking about is going on?
Like, I think his big thing is transparency. And what we've been talking about is a system that's not transparent. People don't understand the financial incentives, the financial motivations of the people who are trying to take care of us. And what I'm hoping, and through talking to a number of people who he's either said is going to be in his administration or are most likely to be in his administration, is he wants to open this up transparently to everybody so people know what they are buying. Hopefully people will start to understand that these incentives are really messed up and will try something different. And that's what I'm banking my company on, is people will try something a little bit different that actually has incentives totally aligned with you. Because I think the world revolves around financial incentives. For the love of money is the root of all evil, right? Like, that's what the good book says. And I do truly believe that people will focus on the incentive of making the most dollars and not on the incentives of making me, the member of whatever insurance plan, the healthiest that I can be. So I think he's going to shine some light on this, which, as we know, light is the best disinfectant.
Help us grow the Fearless Army. Pound that like button, subscribe to the channel, and share this video with all your fearless friends.